This is the heart assessment for advanced health assessment. First, I'm going to inspect her precordium. I'm looking at her chest. I'm looking at symmetry, the rise and fall. I'm looking for any abnormalities, looking at her skin. I'm gonna look at her fingers and look at her capillary refill. She's got fingernail polish on, but I can still see that she's got good cap refill from her cuticle. So her inspection looks good. Next, I'm going to palpate. I'm gonna feel the apex. I'm gonna feel the left sternal border. I'm gonna go down. I'm gonna feel the base, and I feel that. I'm gonna palpate her right sternal border, and now I'm feeling for her apical pulse, which is gonna be the left clavicular midline and the fifth intercostal space down. So I'm feeling for that. I'm feeling for the PMI, the point of maximal impulse. I'm feeling for a heave or a lift, any kind of thrill, anything abnormal, and I don't feel that. If you'll look left for me, I'm going to feel her carotid, and again I'm feeling for a thrill, and I don't feel one, so that's good. Now I'm going to percuss her heart, which percussion is not as good as a chest x-ray when talking about the placement of the heart or the size, but I'm going to start at her left axillary line, and I'm going to percuss until I hear resonance or dullness. And I heard it right there, so I'm going to get my pen out and I'm going to mark it. Then I'm going to go from her right axillary line, and I'm going to percuss. Here's her right sternal border, and so I'm going to percuss over until I feel her left sternal border, which I feel it right there, and I'm going to mark it. Now I'm going to get my tape measure out, and I'm going to measure, and it's less than a centimeter, which is normal. Now I'm going to listen. I'm going to listen to her heart sounds. I'm listening for S1, S2, S1 marking systole, S2 marking diastole. I'm listening for any abnormal heart sounds, S3, S4, any kind of click, any kind of snap, pericardial friction rub, a murmur, anything abnormal I'm listening for. We're going to start listening to her aortic sound. I hear systole and diastole. So I hear S1, S2. I don't hear anything abnormal. Listening to her pulmonic. S1, S2. Listening to her second pulmonic. Hear S1, S2. I'm going to listen to her tricuspid. Hear S1, S2. Now our apical. And I hear S1, S2, nothing abnormal, no murmurs. Now we're going to listen to the same thing supine, so if you'll go and lay down. We listen to heart sounds in different positions because you might catch it laying down or in a different position. So we're going to listen to her heart sounds again, listening for anything abnormal. Listen to her aortic, pulmonic, pulmonic 2, tricuspid, and our apical. Again, everything sounds normal, no murmurs or anything. Now if you'll lay left, this is the left recumbent position. Sometimes it's easier to hear murmurs in this position. hear a murmur or anything abnormal. If I did hear a murmur, I would be listening for pitch, intensity, radiation, quality, anything that's abnormal, and I didn't hear any of that. So that is the heart assessment.
Yep.
This is the lung assessment for advanced health assessment. Alright, first we're gonna look at her chest, we're gonna inspect, we're looking for symmetry, we are looking for the rise and fall, the natural rise and fall of her chest. We're looking for anything abnormal, any kind of retractions, any bulges, any use of accessory muscles, anything abnormal. So if you'll raise your hands for me, looking at her lateral sides of her chest. Gonna look at her back of her chest, and it looks good. Now, gonna look for any landmarks. I'm looking at her suprasternal notch. I'm looking at her angle of Louis, her costal space. I'm gonna go to the back, and I'm gonna look at her costal space in the back. I'm looking at the prominence of her ribs. I'm looking at her, identifying her C7, her T1, and all of that looks good. So now I'm going to palpate. I am gonna palpate her muscles, her skeletal muscles in her chest, her intercostal muscles. I'm feeling for any crepitus, which she doesn't have any. Feeling for anything abnormal, anything that protrudes, anything. I'm gonna feel her lateral chest. All of that feels good. I'm gonna feel her back side. It's all good. I'm going to look at her thoracic expansion. So I'm gonna put my thumbs on her costal space. Take a deep breath for me. My thumbs should separate and come back symmetrical, and they do. I'm gonna do the same thing to the back. Take another deep breath for me. Okay. And she's got good thoracic expansion. I'm going to get my tape measure, and I'm going to measure her diameter. We know that barrel chest is seen in emphysema. So we're just going to measure. Okay, you've got a good diameter there. Next we're going to percuss. I'm going to percuss her chest. It should not be dull. Lift your arms for me. I'm hearing resonance, which is good. Okay. I'm gonna feel for any firmitus. I'm gonna just touch her chest and see if I can feel the vibration symmetrically when she speaks. Say 99 for me.
99,
Say it again.
99,
Okay.
99,
Gonna go around to the back and do the same.
99, 99, 99, 99.
Okay. And I felt vibration symmetrically doing that. Next I'm going to actually auscultate her breath sounds, listening for any abnormal breath sounds, any wheezing, any rhonchi, any rubs, any absent breath sounds. So I'm just gonna listen. Take a deep breath through your mouth.
It's a lot of breath.
You're okay, you can go at your own pace. Okay. I didn't hear anything abnormal. She's got good, clear vesicular sounds in her lobes. I'm going to measure her diaphragmatic excursion. So what I'm gonna do is I'm gonna ask you to take a deep breath. Take a deep breath for me. I'm going to press down from her scapula till I hear dullness. Okay, which is right there. I'm gonna mark it. I'm going to ask you to take a deep breath and exhale, and then just hold the exhale. I'm going to press back up. Okay. And I'm going to mark it, and then I'm going to measure it, and it should be 3 to 5 centimeters. And it is. Now I'm going to do the same thing to the other side. So take a deep breath and hold it for me. Going from the scapular, percussing down. Okay. Marking where I hear the dull sound. Take a deep breath, exhale and hold it. Going to percuss up. Okay. You can breathe. I'm going to mark it. And I'm going to measure this side. Should be 3 to 5 centimeters, and it is. Next, I'm going to really look at her respirations. I'm looking at her rate. Just breathe normal for me. I'm going to count her respirations. They should be between 12 and 20 in a normal rhythm. So just breathe normal. Just counting the rise and fall of her chest. She's got a normal rate and rhythm. She doesn't have any abnormal rhythm. She doesn't have any abnormal respirations, no tachypnea, bradypnea, hypopnea, Kussmaul, Cheyne-Stokes, or Biot respirations. Her respirations are normal and good. Next, I'm going to listen for any vocal resonance. So I'm going to listen, and I just need you to say 99.
99. 99.
I shouldn't be able to hear her clearly say 99. It should be muffled.
99.
And it is.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. Now, if I can get you to kind of lay down on the couch just so I can hear your interior breath sounds while you're playing. Take a deep breath. All right. And again, all that sounds good. So she's got some good lungs, and that's the end of the assessment.